All right. So my name is Benjamin Villarreal, and I chose to do my practicum as the analysis of West Nile virus in the Summit County mosquito population. So for some quick basics, West Nile virus in the United States began as an outbreak in 1999 in New York City, and it spread across the United States from east to west. Birds are the reservoir population, specifically blue jays and crows, and human cases are 80% asymptomatic. For the public health significance of West Nile virus, 20% of cases have a headache and fever of varying degrees, and about 1 in 150 cases develop brain and nervous system inflammation, such as encephalitis or meningitis. But in those 20% of individuals of all the cases who have symptoms, they're somewhat vague. Headache and fever can be a lot of things, so it's hard to have accurate public health statistics on the not so severe cases of West Nile virus in humans. To talk more about the outbreak of West Nile virus in New York City, it began in 1999, and there were 78 patients who were hospitalized, 9 of which died. So overall, among hospitalized patients, there was a 12% case fatality rate. That doesn't reflect all of the minor symptomatic or asymptomatic cases, however, so that should be interpreted carefully in the context of those hospitalized patients. 48 patients of the 78 hospitalized developed encephalitis, and 9 of those 48 died, so there was a 19% case fatality rate in the hospitalized patients who developed encephalitis. And this source says that there are about 110 asymptomatic cases for every case of meningitis or encephalitis related to West Nile virus between 1999 and 2000. So there's room for there to be some significant impact in people's lives here, even if it doesn't appear to affect a large number of the cases that are affected. Some of the factors that affect West Nile virus spread are competent vectors. The vector for West Nile virus is predominantly Culex species mosquitoes, which choose to lay their eggs in pools of stagnant water. So not running water, not swimming pools that are well maintained, just pools of stagnant water that could be around the house in tires or in bird baths that are not frequently tended to, and that sort of pool of stagnant water around the house. The possible reservoirs are mammals, but specifically birds, such as crows and blue jays, which serve to amplify the virus in the environment. As well as another factor involved in the spread of West Nile virus is the ability to overwinter, which means that the virus can survive the cold temperatures of winter here in Ohio and other states, either by residing in a mosquito, which is dormant over the winter, or in birds. Some of the statewide efforts in Ohio were put in place by the Ohio Department of Health in 2002. They began tracking the surveillance efforts around the county and collecting statistics. In 2002, there were 441 human cases of West Nile virus in Ohio and 31 fatalities. So there was a 7.25% case fatality rate among the reported cases, which were severe enough to warrant having a West Nile virus test done. So it doesn't necessarily capture all of the cases that occurred because, like I said before, 80% are asymptomatic. And there was a decrease in the number of human cases by 2010, where there are only 5 cases across the state with no fatalities. But, as I will talk about, that trend has changed recently, at least for Summit County. So Summit County Public Health has a mosquito control department that's been in operation since 1999. There are 3 components to this. There's surveillance, larviciding, and adulticiding. Surveillance consists of setting traps at different points around the county that are strategically located by areas of low-lying land where water can collect or where we see water, maybe in the woods, and then these mosquitoes are drawn to these traps because of their characteristics of the traps. There's also larviciding, which consists of treating areas of water where larvae are found by using these white scoops, like basically a cup of water. You scoop out of the body of water, and you can see if there's little wiggling larvae, and if there are so, we can use a variety of different control methods, such as bacteria that only affect the gut of the mosquito larva, or using oils or different pesticides, depending on the sensitivity of the area. And adulticiding is perhaps the most visible part of the control program, which is involving the mosquito trucks driving around at night at a slow speed and fogging. However, the adulticiding only affects about 100 feet on either side of the road, so it's better to have good prevention than trying to treat the adult population that's already hatched from mosquitoes. So the gravit traps we use are these traps here, and there's several parts. there's a basin where we place the stagnant water, which is made by having grass sit in a jug of water in the sun for about a week. And then this gets really nasty and stagnant, just the way mosquitoes like it. And the mosquitoes drawn here are female mosquitoes that are attempting to oviposit. Oviposit means they're trying to lay their eggs in the water. So these are ovipositing traps, also known as gravid traps. Now, the organic material mimics the egg-laying water sites, and a battery-operated fan draws air up through the bottom of this pipe and out through the top. But there are mosquito nets inside the trap which prevent the mosquitoes from exiting out with the movement of air. The trap is filled with stagnant water up until just below the height of the pipe, and then they get trapped in the trap. And the traps are cleaned out every day, so there's no chance of the larvae growing in these traps that we're trying to say. Now, the females that are attracted have had blood meals because that's a component that's required to have egg production. So these are mosquitoes that are more likely to contain West Nile virus because they've already taken a blood meal either from birds or other mammals or humans. So my research objectives for this public health problem were to produce ArcGIS maps that show the progression of West Nile virus across Summit County, and to prepare a pathway for geocoding, which means finding the geographic coordinates for all the trapping locations and other data we collect for all the mosquito records. To geocode all of the West Nile positive trap sites between 2002 and 2012, and to geocode as many complete years of trapping data as possible, of which I was able to do all of 2006 and 2012. There are over 1,000 lines in each of those years, so it took a lot of time to look for all the trap sites and to make best judgment calls on which side of a dead-end road the trap was on, for example. So looking a cursory glance at the mosquito record show that the number of mosquitoes trapped per year has generally increased. So for 2002, there were 8,567 mosquitoes trapped, and 2011, 87,442, and 35,074 in 2012. And these were all hand counted by employees at Summit County Mosquito Control, so that's a lot of counting to do. For the West Nile virus positive pools, there were 50 in 2002, 7 in 2010 when that report showed that there was only 5 cases for Ohio, but in 2011 and 2012 the number increased to 97 positive pools and 156 positive pools. So the positive pool, to clarify, when we go collect traps from a site, if there are 200 mosquitoes, we allot them into test tubes of 50 mosquitoes that are then sent off for testing. So a group of up to 50 mosquitoes from a site is called a pool. So when I say a positive pool, that could be there was more than one increment of 50 from that trap site or just the one. For the vast majority of traps, just one of the pools of 50 increments had a West Nile virus positive pool. But the raw numbers aren't really enough to give a clear picture of the public health implications. So 50,000 mosquitoes or 20,000. Is that because we had more traps? Is it because there were fewer traps? What about the number of positive pools? So I need to have a context to put these numbers into. That's when we have the minimum infection rate. And this is the number of West Nile virus positive pools divided by the total number of mosquitoes trapped multiplied by 1,000. And we're assuming that only 1 out of the 50 mosquitoes in each pool was positive. So this is a really conservative way of saying this is a minimum infection rate, because it could be that 3 out of those 50 were positive for West Nile virus, but we're not going to make that assumption. We're only assuming a minimum of 1 per unit of 50. So the higher the minimum infection rate, the higher the risk of being bitten by a West Nile positive mosquito versus a West Nile negative mosquito, because there's at least 1 in every 50 for those pools. So here's a graph of the minimum infection rate per year. In 2002, the minimum infection rate was 5.84 pools per 1,000 mosquitoes trapped, and then it declined to less than 1 between 2003 and 2010. But in 2011, it began to increase again, and we had a minimum infection rate of 1.11. In 2012, it was 4.45. So even though there was a decrease in the number of mosquitoes trapped per year, a greater proportion of the mosquito pools had a positive, at least one positive West Nile virus mosquito. So now, how do I actually go about analyzing this data? Well, I used a program suite called ArcGIS, which GIS stands for Geographic Information Systems. Now, this is a great system because you can store and analyze information. You can make dynamic maps that you can update readily and to whatever specification you like, and it's readily updatable. So you don't have to make a giant map and then only be able to move pins around. It makes it much easier to have a refresh of whatever data you want to look at in different contexts, or perhaps you only want to see one political subdivision in Summit County as opposed to all of them. And it's easy to print off different portions of a large map to address a concern for a specific location, or just to look at comparisons between different locations in the county. It's very valuable because it provides quick access to all the data you have through ArcGIS. So these are two maps that I produced for Summit County, and the one on the left is the trap averages for all the traps that were set in 2006. The symbols that are used to represent each trap are proportional in size to how many mosquitoes were caught. So where they're very small circles, such as a number 8 right here, this little green circle, that means that across the entire summer, between May and August, the average trap per trap count was 8. And this could be because there were just not that many mosquitoes there, or perhaps there were only traps set a couple times because equipment didn't work or that kind of thing. But the full data is also available. It's just easier to look at it this way as an average for each site, because there were some places that definitely had a lot more, such as this area here near Fairlawn that had 125 or 144 as an average across the entire summer. I did the same for 2012, showing proportional circles, and in this case, there are more mosquitoes that were caught in 2012 than 2006, so all the circles are slightly larger. Bath, there was a trap site that had an average of 224 mosquitoes per trap over the whole summer, and in Hudson there's one that had 178. So just by looking at this, we can look at the political subdivision of Bath in 2006 and 2012 and see that there was more mosquitoes on average per trap collected. I also have the full data for this, so you can look at certain months you can look at, or perhaps only mosquito traps that had over 50. You can basically pick and choose whatever parameters you want and make a map on the fly of that information depending on what question is being asked. Now, I also charted the West Nile virus positive trap site, so the locations. And by trap site, if it was positive at least once out of the 5 times it was set, because most of the traps are set an average of 5 times per year throughout the summer, spread out somewhat evenly. So for 2006, we had 21 West Nile virus positive sites, and these are shown in a light pink color here. And in 2012, we had 121 West Nile virus positive sites. And between 2006 and 2012, West Nile virus spread to jurisdictions where it was previously absent. Now, it's important to know that we also have the context for where mosquitoes with West Nile virus were not trapped, because these green circles show all the traps that were placed in 2006 and 2012, the locations anyway, that did not have West Nile virus. So there was West Nile virus in this area, but there wasn't any trapped throughout the summer in this area here. And the same here, there's a little band of West Nile virus that's surrounded by traps that were not positive in 2006 or 2012. Now this picture only shows 2 years, because I only had time to geocode 2006 and 2012 in their entirety. I did get all of the years of West Nile virus positive sites, but once the rest of the years are geocoded, you'll have even better context for where mosquitoes that were West Nile virus positive were and were not, because we'll have all the trap sites that provide pretty good coverage around the county. The minimum infection rate for 2006 was 0.7, so I guess you could assume that there would be a lower number of mosquitoes that were trapped with West Nile virus, which was the case. And for 2012, it was 4.5, which basically supports that there would be more West Nile virus positive mosquitoes in the environment available to be caught. So I have produced a very large map, which is right behind me, of all of the West Nile virus positive sites from 2002 through 2012, and each year is color-coded, starting with a dark green for 2002, and changing to yellow in 2007, and that changes to orange in 2010, and that becomes red in 2012, just to provide a gradient to show the years. So we can just pass this around here just to look at. Your handout showed as well, but it's easier to look at this large map. Another useful feature that we came across in my practicum was the production of spray maps, that you could basically create a spray map to show with a custom radius around a point on the map where we found West Nile virus. So for this region in Hudson, there was a positive trap site in 2011, 2002, and 2009. So we have a pretty good estimate that there might be positive traps coming up this year as well. So I used as an example an 800-meter buffer around the trap site. I've read different literature that talks about the flight range of mosquitoes. One that was very optimistic in their ability for the Culex species mosquitoes that carry West Nile virus. They're saying it could fly up to a mile. I talked to Dr. Andrew Curtis, and he told me that there are probably around 300 meters for actual distance that mosquitoes fly. So this is an 800 meters is somewhere between a mile, which is 1,600 meters, and 300 meters. So I chose 800 for this example. But the point is, with GIS, you can choose whatever radius you want depending on the source of a mosquito flight range you want to use that you trust as much as that you trust. So these maps were made by overlaying the parcels of land and who owns them for Summit County. The light blue color shows every tract of land that is public or privately owned in Summit County, with holes in the map where the roads are or where public land is. Now this is really neat because it's kind of like having two pieces of construction paper, a black one on the top and a red one on the bottom, or in this case light blue. If I cut out little pathways on the blue construction paper, I can put it over the red one and you can see the red shining through where the streets happen to be, because streets are not covered up in the parcel map. So by coincidence and really good luck, it turns out that we can have really nice maps of a radius around a point of the streets that need to be sprayed for West Nile virus, and we'll be able to show the people that spray at night where to go exactly to cover an 800 meter or whatever meter radius you want around a positive trap site, or around traps that have a high number of mosquitoes as a way to control nuisance mosquitoes as well. So the rows are not included, the layer shines through, and it shows us which areas need to be sprayed at night. So now I'm going to be audacious and try to do a live demo here, but it's going to take a moment because I need to restart my computer into Windows. So just give me a moment to get the live demo started. Okay, so I'll work around that display being off to the side like that. That's all right. Just bear with me, it takes a while to load. It's a really interesting piece of software that I really like, but it takes a while to load sometimes. maybe one more minute. One more minute, I think, and then we'll call it. One more minute, and then we'll. Yeah. There we go. All right, excellent. Okay. Okay. Very good. So. Okay, so on the right side of the screen, the left side is cut off because of a problem with my adapter, but we can still show enough of the screen to get the point across. We can see the map of Summit County that I produced using the freely available GIS base maps, which are basically the levels of their elevation information, there's satellite imagery, there's street locations and properties, and there's like the different political subdivisions within Summit County that are available from the Summit County Fiscal Office to assist the public and researchers in doing research on the county. So here, I combine the different layers of the jurisdictions which show the different parts of the county and who they belong to as far as political subdivisions, a low resolution map, or I guess satellite imagery of the county as well, and if you zoom in closer, there is highest resolution imagery available as well behind the jurisdiction map, so we can see high resolutions of different parts of the county. So for the layers that I used, there are different layers in my map. So I have West Nile virus pools for 2012 to 2002, trap averages for 2012, trap averages for 2006, West Nile virus for 2012, and so on. Different parcel information that shows who owns what plots of land, so we could contact those people if there's a particularly high number of mosquitoes or for whatever reason. Trap averages for 2012 that were over 100, which is an example of a custom layer you can create based on a search of your overall data. So if what I did was, for 2012, I opened up the table of all the data, and then you can go to do a custom search by specific attributes. Oops. There. So we can choose, okay, I want to know where all the traps were, where there were greater than 100 mosquitoes in that trap. And then I could apply this, and then I would see which selections showed up on the map. And I could basically make a layer out of that. So you can make a map on just about anything you want quickly, which is really, really useful. I also had the custom buffers around those, so 800 meters. I had one for 300 meters as well. There are streets and there are major roads according to the census. There's zip code blocks, there's census tracts, and many different layers that can be put in the map. So I saved a specific place in Silver Lake as an example for my West Nile virus spray maps. So here are some traps that were placed in 2012, 2010, 2002, 2011. This area has been trapped a lot in this same spot. It's a good place. There's low-lying woods. It's away from the public, so they don't mess with the traps. There's a possibility of water pooling there, so it's a good place for mosquitoes to grow. And these times were instances during that year of 2010, 2011, where we did find West Nile virus positive mosquitoes. So say we find one this year. We can create a map or a buffer around that point in 300 meters, for example. Here's 300 meters around those points. Or we can create one that's 800 meters, which becomes a lot larger if you're being more optimistic about the range of the mosquitoes. So let's do 300 meters. So here we see that these roads are being covered up, and we can't really see what's underneath this red disc of a radius around the mosquito area. We can turn on the parcels here, and that shows the different properties and who they're owned by. But more importantly, it has gaps where there's streets or public property like lakes, and we don't spray lakes, but you could see the streets that need to be sprayed to cover 300 meters around the area. So I turn the street layer on, and we have names, so we can say, okay, you need to spray this spot on the street and this area in order to cover a 300-meter radius on the streets where we can spray around that trap site. So that's really, really useful, and they can be for any area of the map. So I can zoom in somewhere else and maybe make a map right here and print off this section by going to the print side of this and print that off, and here we have a nice logo and label and the different codes for what the legend is. So it's a really great tool for being able to quickly make decisions on a visual basis that shows you exactly what you have to do. Because we have a lot of information in the spreadsheets, but it's hard to pull it out on a quick fashion because there's different spreadsheets for different years, and this just helps tie it all together in a really, really interesting way. So I'm going to go back to my PowerPoint now. There we go. Okay, so that was a live demo there. Now what's next? I'm going to be helping to train subsequent Mosquito control student employees on how to do this stuff, because a really, really big part of this project is establishing the pathway for how to get the data in a way that can be read by ArcGIS. And to do this, I would use the spreadsheets we had from all the data showing where the traps were set, and then look up those locations in Google Earth, and then drop a pin on the map showing where our best estimate of where the trap was placed was, and then get the coordinates for those and set them up along a new spreadsheet where we could then import that spreadsheet into ArcGIS, and it's all tied together nicely. And that was the systematic way of geocoding the trap information on a daily basis as well. So as students go out to set traps and then come back for the day, they will be able to go on Google Earth, drop a pin where they put the trap, get the coordinates and put that in the spreadsheet. And that way you can do it on an ongoing basis where it only takes a few moments instead of weeks and weeks to do code the 2 years I did code. So that was what I'm hoping to do with my practicum. So I would like to acknowledge Terry Tuttle and Andrew Deacon of Summit County Public Health, who gave me access to the Mosquito data as well as employment last summer. Dr. Andrew Curtis of Kent State University's Geography Department, who advised me on using Google Earth instead of trying all these different ways that I was trying to do for inputting data. I was trying to find addresses and then import those addresses separately. I was doing a multi-step process that was overly complicated and unnecessary, and it showed me a really great way to simplify it down, and now I can pass on that method, which is much easier to do than all the fancy stuff I was trying to do. I'd like to thank Summit County Fiscal Office for making those GIS maps available. I didn't know those were available at all until February this year. I don't know anything about GIS until this year, and I'm really happy that I know now because I'm aware of a really, really powerful tool that can do a lot of good. Dr. Eric Jeffries, who helped me organize my crazy maps and helped me figure out why stuff wasn't working. Dr. Bada, who helped me chart a course through the project and change from going in an analytical fashion as I started into a much more immediate use tool. And the College of Public Health for having all of our great instructors and faculty and staff that helped me get here where I am today. And if there are any questions, here's my contact information as well. So that was it. Yes. I think long term, it's easier to be more transparent when the data is so much more accessible in this way. So there are programs for ArcGIS that allow you to have live sites that show maps and different layers on them. Like the Summit County Fiscal Office actually has GIS maps available online that you can browse through, but you can't really add layers to that. So we could incorporate, if the department chooses to do so, maybe live stuff as maybe updated once a week showing where the positive sites were. Maybe you should really, really pay attention to mosquito avoidance practice, like dump out your bird baths at least, a couple times a week, wear long sleeves and clothes, wear mosquito repellent. So you could have like a much more powerful public health message saying, look, we found this in your area, so you should really pay attention and do something about it. So it makes it much easier for public outreach, and it doesn't really cost that much because all you have to do is make the maps and then make them available. You don't have to mail them out to anyone because they can be online. Yes. Yes. No, I found that calculation in different literature, but it basically just is a way of showing, like, I don't want to say relative risk because that means something now. That doesn't mean what I used to think it means. That has an actual meaning, but it shows, like, I guess you can say a greater chance of being bitten by a mosquito if there are more pools per 1,000 caught that have a positive mosquito than one that has less pools for positive mosquito. So I didn't make it up, but it is like an official term that's used. Yeah, that's true. That's true. Yeah, and with the data we collected, it is possible to then use all the data that's already been inputted or been inserted into the ArcGIS to do a new calculation. So since it's already in ArcGIS, we can calculate whatever different method is preferred, depending on the time or depending on the appropriate standards of practice at the time. So with this program, you can do new calculations much easier than having to do them all by hand, which is nice. So, yes. Oh, so those circles on that big map that was passed around and the handouts, those circles represent a location that had a positive pool over the summer. This map, in that case, did not show how many pools had more than one, I guess, pool per trap site. It just shows where there were mosquitoes that West Nile virus positive ever. There are 300 and something that we've ever had in Summit County, and those are all located on the map there. But we could produce a map that showed how many pools there were. So maybe you had 5 pools or something. That would be maybe more indicative of a bigger problem. So we could do that with all the data we collect. So it is possible to, maybe provide more detail on a as you want to go basis. Sorry, what? No, those are on there. Yeah, where they were placed. Yes. Yes. No, it was actually higher than that in 2002. Yes, it was 5.84. Yeah. I don't really have any information about that from this practicum, although we've speculated that it could be because of maybe warmer winters where there are less mosquitoes that are, contain West Nile virus that didn't, that were able to overwinter when they wouldn't have been able to, or perhaps the bird population affected that with different migrations with temperature or just wetter seasons. I don't really have information in this presentation to speculate though, but I can talk about that with you later.
What's done after these hot spots are found?
When you find a hot spot, we can have the mosquito spray trucks fog the area at night. So what they'll do is they'll drive around the county and spray in the areas where we find maybe a large number of mosquitoes or we find West Nile virus positive pools. So they'll basically turn on the fogger at 15 miles an hour and fog along these roads, which will kill the adults within 100 feet on either side of the road, but it only lasts overnight because the sunlight decays the insecticide or the pesticide, and it only works, on mosquitoes that are in flight. And so it's a really helpful tool, but it's probably more useful to go and tell the public you should clean out your water, because it can only fly that range. So if everyone in this area cleans out all their breeding sites, then, or at least a number of them do, it'll reduce the chance of a human case of West Nile virus occurring. So.
And who is most affected in terms of their health by West Nile virus? I mean, is it like kids and elderly? Is that?
I came across literature showing it was mostly elderly people that had severe problems from it.
Okay. Well, because I was going to ask, is it possible to map like long-term care centers or elderly centers to be able to see, where they are, or like daycare centers or schools, so that you
concentrations,
can
right?
prioritize where you're going to, do your intervention, whether it be spraying or whatever.
Or mosquito avoidance practices. Yes, what you do is you could search Google Earth and different sources for all the different locations of these facilities, and then find their address and drop a pin on the map, and then we could see where they were on the map in context with our mosquito practices currently, and maybe we could move the traps around to maybe monitor these vulnerable populations. That's a good idea. We could do that. We could incorporate that information into ArcGIS as a separate layer and then overlay them and see what we get. So yes.
Are there any proactive things? Because this is sort of a reactive, whereas, you set out some traps, and then if it's positive, then that sort of tells you where to spray. Is there anything that you can do that's proactive?
Well, there are topography maps that show the different elevations, so you could use that along with days when it rains. Maybe you could do a sophisticated analysis to see where water is likely to pool. I know that city planners and engineers use ArcGIS for like building planning and stuff, so it's probably possible to see where rainfall is likely to collect, and possibly someone's already doing that for construction. So it could be possible to do that and maybe target those areas ahead of time. Or we could look at the historic data where they've been happening already and say people that live in this area should focus on emptying out any containers they find in their neighborhood, just talking to their neighbors. So it is possible to use historic data and data that's already existing to inform people of that problem. But because of the nature of the traps, we have to have the results sent off for a week or so, I think, before we get any information about them. So it's kind of reactive, like you said. But depending on what you do, you can use the landscape and topography to figure out where good places would be for setting traps as well.
Thank you.
All right. Yeah.